Hey, what's up? In this video, I'll be showing you how to spike and prime an IV with special nursing considerations. But before we begin, if you're new to my channel, welcome. My name is Christina, nurse practitioner. Make sure to subscribe and turn on that notification bell. Let's get into it. So when you're administering an IV medication, it will be given through an intravenous route. Your access may be a peripheral IV or a central line, let's say via the right IJ. It could be a PICC line in your right upper extremity or a portacath, to mention a few. Prior to starting, you always want to make sure you do best practice per hospital guidelines with a sterile no-touch technique when priming an IV to reduce the risk of infection. I remember my instructors were so intense when it came to the no-touch technique. I mean, they had all good intentions with spiking your bag. Like, fear was instilled in me that I could pose a risk of sepsis if not done right, and making sure you scrub that hub. So trust me, you'll have plenty of opportunities to learn the task and get really good at it. It just takes time. The equipment needed will consist of the IV solution bag. So make sure it's in a plastic bag, it hasn't been tampered with, and it's not expired. You want to make sure you have good IV access and good blood flow and it's patent. You want to make sure you have your IV pole. You also need your IV administration set. You may also hear it referred to as IV line, IV tubing. So the actual set may vary, and it's based off of the pump you use for your hospital, because you will also need your pump. However, hand in hand, spiking and priming, it's all the same. Now within the IV set, it will have a blue tab, that what we refer to as the vent, and some tubing may not have it. However, most hospital IV sets that come from the manufacturer do come vented, because some medications come prepared in a glass bottle, such as like your albumin or Ofirmiv, also known as Tylenol, or your nitroglycerin drip, that require a vented IV tubing. In that setting, you actually would want to open the tab to allow the medication to flow through the IV tubing. But in this setting, it's a plastic bag, so it doesn't matter, just a little FYI. So before we get into the hands-on demo, always remember to verify your 6 rights: right patient, right medication, right dose, right time, right route, and right documentation, and do your hand hygiene. Let's get into it. So I'm gonna go through the actual IV tubing so you're more familiar with it. So from the top, this is your spike. Anytime you remove your tubing from the package, you want to make sure that the plastic cap is in place. If it's not, you want to toss it because it's not good. This is a part that you never want to touch that spike. You never want to take off the cap until you're actually ready to actually spike it and prime. And then this is the vent we're talking about. This is what you could open in the setting of using a glass bottle. You would keep it open. In this setting, we're going to have it closed. This is your drip chamber. And then this is another vent that helps with the priming to remove air when you're priming it. And then these are your ports where you can help, where you can remove air bubbles from, or if you need to give medication closer to the IV line. And then this is the clamp. This is where you insert it into the actual pump. And then this is an actual the actual clamp where you're gonna, if you need to put a hold on it, you can clamp it here. And then this is where another little clamp, another safety guard. If you need to make sure that you don't want to give the patient a bolus before starting it, you could also clamp it there. And then this is where you would actually attach it to the IV. And then if you're gonna give any IV pushes, this is the port that you would use, which is closest to the end port. Alrighty? So your IV bag, you always have 2 ports. This port right here is where you would have to, if you have to reconstitute medication, and then you would label it. I have a video on that in regards to reconstitution of Levofed, or how to make a Levofed bag. So you would clean the hub and then you would inject the medication into there. And then this little cap, usually it's blue, but in this setting, it is red. This is where you would remove it. And then this is where you're actually going to spike it. Okay, so when I'm about to spike my bag, I put my clamps on. So I'm gonna put my clamps on right here to close, to off. I'm gonna take off, so I am ready to go. So I'm gonna take off this cap. Okay, so the cap is off, and I'm not touching that. I'm also going to pull off the red cap, okay? and then I'm going to hold it with one hand. I have the bag on the IV pole, and then I'm going to put it inside, and I'm going to twist it in. So you twist it in, and then you're going to squeeze the drip chamber, okay? And then once it's ready, you're going to open it, and then it's going to drip in, and you're going to see it drip in. It's going to go super fast, and as you get closer, you want to make sure you start putting the brakes on. Then you can clamp it here. You want to make sure there's no air in between the line and no air bubbles. And then this would be attached to the actual IV line. Okay, so I want to do a little housekeeping. You want to make sure you change your labels, and based on protocol, it can be about 72 to 96 hours that you'll want to change your tubing. In the setting of using propofol, you want to change it every 12 hours. You also want to be familiar with some medications may need an actual filter added to the end of the port of the IV before you actually insert it into the IV. Some of these can be like Dilantin or your TPN, or if your patient has a history of like a PFO, which is a patent foramen ovale. This is when there's an exchange of blood between the right atrium and the left atrium, and there could be a potential of a pulmonary embolism. And so in this setting, you would want to attach a filter to the IV line to prevent the risk of a PE. Don't forget to smash that like button. I'll see you on the next one. Take care.